Hello, I'm Delusion Dispeller, and I am talking about dialectic behavioral therapy. In our first video, just a very quick recap, we discussed how dialectic behavioral therapy came about from Marsha Linehan, who wanted to make a new type of therapy that would especially help those people that had deeper set needs and had been through very extreme traumas that did not respond well to the cognitive behavioral therapy of the day. So we pick up from there. Hopefully you got the chance to watch that first video. And we pick up from there and talk more about how it all works. Okay, let me see here where I left off. Okay, using dialectic behavioral therapy in sessions helps those sessions move along a little bit more quickly, have more of a flow to them, and it helps to stay on the topic at hand. Rather than with many borderline personality disorder patients, things can get a little bit heated and end up in arguments or I will not, you will too, that kind of bickering back and forth, trying to convince the client to do what's best, that sort of thing. Well, dialectic behavioral therapy eliminates a lot of that, and it helps to stay on focus during the session. Now, you might be wondering, how does DBT actually work? First of all, how it works is it helps the client to become and stay motivated to make the changes that they need to make and to do the work that enables this to come about without feeling forced, pressured, coerced, or in any way, shape, or form manipulated by the therapist. Number two, it shows the client that he or she can make those changes on their own based on the results that they receive from doing the things that are suggested and making those changes. Number three, it helps the client because these goals that they're working towards are geared to be suitable for their environment, so they do not set lofty goals that are not able to be attained. And in fact, the quickest way to reach any goal is to do it in little steps and make it attainable, not something that's way out there that you're sure you're probably never going to reach. People with borderline personality disorder have been through a lot of very deep trauma and find it very difficult to bite off huge chunks of, well, you need to do this and then do that and then do this and then say this. Yeah, they can't do that. They need little steps to take, and as they make those steps should be encouraged and congratulated all along the way. This is what dialectic behavioral therapy does. Number four, DBT utilizes the therapist's ability to help the client in the best way possible. The therapist learns ways to reach each client because every situation and every client is unique and different. And the therapist is trained to listen and learn from the client as to how to best reach them in their unique situation. Number five, the treatment is structured in such a way that will be successful for both the client and the therapist. Now, the way that this is or organized, you might say, is that the client is set up in something called skill classes. This teaches skills in everyday behavioral things, such as we might take for granted if we don't have borderline personality disorder and other issues like that. For instance, mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. Things that are stressful for one person may not be stressful for another person, but to a borderline person, stress is something that's very intense and very unbearable at times. These skill classes help teach them to be present in the moment so that they can handle each one of these things as they come up and learn new ways to cope with and handle these things. Phone coaching. If the borderline patient is about to cut or harm themselves in some way or harm somebody else, which generally that's not a borderline thing, they usually self-harm, but in case their anger gets out of control or they feel suicidal, they are to call their coach. There's such things set up as a phone coaching session where they are allowed to call their coach at any time they feel that life is getting to be too much for them. Also, The client is given homework, certain things to work on, little bits and pieces here and there, how they're going to react in certain situations, how they will relate in certain situations. And they do that homework and they bring it to the next therapy session to be discussed with the therapist. Number 6, weekly meetings for therapists. Now, you might think, well, the client is going to all these meetings and having homework and everything. That's great. How does the therapist keep up on what the client needs? The therapists in dialectic behavioral therapy are expected to go to weekly meetings with other DBT practitioners, and gain encouragement from those people based on how they handle the sessions, which they discuss, and also given further training as needed. So this way, they can keep up on finding out what is working, what is not working, the new things they need to try with this client that they may not have tried yet. It's a great collaborative way to keep people on track and also accountable. I think it's a great idea. On the next video, I'm going to be talking about exactly how all these things are implemented in a session. Stay tuned for my 3rd video on dialectic behavioral therapy. Hopefully you can find some help for those that you love or even for yourself. God bless you. Stay tuned. Bye.